Welcome to another episode of Talking with Docs. I am Dr. Paul Zalzal.
And I'm Dr. Brad Wiening.
So today we're continuing with our videos of injuries that people have sent in to us with their diagnosis. So we're going to show a video, give you the diagnosis of the injury, and then discuss it a little bit.
Okay, so on today's episode, we have a gentleman who is a skateboarder and was attempting a trick and was not completely successful. So let's start with the video. So here he is.
Coming in a little hot.
Coming in hot.
Bang, okay.
Jeez.
Right there when he hits the ground, you can see that his left knee takes what we call a valgus load. So the knee goes in while the ankle goes out. So really puts a load on the outside of the knee.
Planted very awkwardly. Good height, good distance,
good
just
distance,
couldn't stick the landing.
Good style.
Good style. Good
No
style.
helmet. That's a problem. You've got to wear a helmet if you're ever going to try anything like this. A, don't try anything like this. If you do, wear a helmet.
It would not have protected his knee, however.
No, true. So what kind of injuries, aside from death, can occur with this kind of a trick?
So anything to the lower extremity. So impacts like that could break your tibia, could break the upper part where it joins your knee, or a tibial plateau fracture. You could break your ankle. Really limitless. You could break your hip.
Yeah, okay. So in this case, I would say luckily, his only injury was a torn lateral meniscus.
So after this injury, Paul, what happens to him? How does he know that he's torn a meniscus?
Well, I think he would have felt immediate pain on the outside of his knee after that injury. May or may not have been able to walk on it.
Could he walk it off?
Yeah, that's something I don't think you can walk off right away. You're not going to shake that one off without a little bit of time to heal. Why don't you show us what a meniscus is?
Well, as luck would have it.
There you go.
This handy model shows us that this is a model of a right knee. So this is your thigh bone or your femur. This is your tibia. And in between those two bones are little shock absorbers. And if you see there, they're both horseshoe-shaped, or as Paul likes to refer to them as donut-shaped.
They look like donuts.
Yeah. And you can see they're thick on the outside. They taper in to be very thin on the inside. And it's that thin inner margin that is prone to tearing, particularly because the blood supply comes from the outside to the inside. So once they're torn, often they will remain torn. They cannot heal on their own unless you're a young child.
Mm-hmm. Okay, so that's a meniscus. He's torn the meniscus.
Yep.
We know that now, but first of all, he's got probably a painful, swollen knee to start with, and he's going to go see his doctor. And what's going to happen when he sees his doctor?
So usually, just like every other injury that we've talked about in the past, a history and a physical examination that will reveal what Paul found. If you did an x-ray, it would rule out the presence of a fracture, but is likely going to be normal in this setting. And then ultimately, this patient went on to have an MRI, which is a special test that looks very closely at the soft tissues, and it was able to identify that he had a tear of his meniscus.
Okay, so he's got a tear of the meniscus. What are some of the symptoms that he might be feeling from this torn meniscus? Let's say he's got the swelling and the pain.
Yep.
Over that couple of weeks, that kind of settles down. The acute part of this injury settles down. What's he left with?
So usually my patients tell me that they have ongoing intermittent episodes of sharp stabbing pain that's usually right along the joint line, so either right on the inside or on the outside of the joint. Typically aggravated with planting or twisting type activities where the thigh bone is digging on a piece that's torn, or when they do a deep squat. That curved part of the femur really pushes on where the tear is, and they don't like to do a deep squat. They don't want to play back catcher anymore.
Right. So, we have a video on this that we've made called Meniscal Injuries, I think.
Yeah.
And so you can watch that if you want some more detail. But at the end of the day, we're going to see mechanical symptoms, we call them. Mechanical symptoms occur from these meniscal injuries. So sharp shooting, catching pain, the knee might even lock.
Yep.
What are we going to do about it?
So I tell these patients typically they have two choices. So the first one is just to wait it out, see what happens, depending on the severity of their symptoms. If they feel that it either prevents them from doing things that they like to do or need to do, like skateboarding, then potentially you could discuss surgical options. Now in surgery, Paul, do you fix it?
Well, that's a good question, because a lot of people think, I got a tear, I got to get it fixed. In the meniscus, as Brad said, the outside of the meniscus has the good blood supply, but as luck would have it, you usually tear it on the inside where the blood supply isn't good. If you do not have a good blood supply, fixing it won't work. So there's no way to repair it, so we debride it, or we shave off the torn portion so it's not tugging, pushing, catching, or getting locked in the joint. The meniscus isn't doing its job now that it's torn, so by shaving that stuff away, you're not doing any more harm. Is
it obvious when you get in there?
The tear?
Yeah.
Well, let's take a look.
Okay, so the first video is a picture of what's called arthroscopy, where you go to sleep typically, you make two little cuts along either side of your kneecap tendon that's been removed from here. you fill the knee with fluid, and then with a very small 3.5 or 4 millimeter camera, you look at all the tissues inside. So on this first video, you can see that this meniscus is normal.
Yeah, this is actually a medial meniscus, but they look very similar. So this meniscus is normal, there's no tears in it, it's got a good size to it, so normal joint basically. Let's roll the second video, which we have an arthroscopic video of a meniscal tear.
And you can see in this one that it looks drastically different. Yeah. It's frayed, it's ragged, it looks abnormal.
And you can see we're bringing in an instrument here just to debride it, to cut off the torn portion and leave a stable rim.
I always talk about like clipping your fingernails, kind of removing that little piece.
You do.
I do.
I've never used that analogy, but it sounds like a reasonable one.
Good. So after you have that done, are you right back to skateboarding?
So there's a recovery period, just like anything, especially after surgery. You know, I would have this guy not skateboarding again anywhere from 4 to 6 weeks after a scope, but that's quite a variable time depending on how quickly you recover, how much you physio.
Yep. And then, yeah, but back fully weight bearing right away, and then activities as tolerated once your pain and your motion and your strength is returned back to normal.
Yeah, and it's important to note that you may have this meniscal injury and you may get better on your own. 80% of the time the symptoms go away and you do not need arthroscopy. Yeah. It's just for those ones that after 4 to 6 weeks you're still experiencing those mechanical symptoms, then you might want to consult with an orthopedic surgeon and talk about planning surgery in case those symptoms don't go away.
Very interesting case.
There you go. So if you have any fails out there where you have an injury and a diagnosis and you'd like us to discuss it, please send them in, email them.
At info@talkingwithdocs.com. And if you like this video, please like it on YouTube or subscribe to our channel.
And remember, you are in charge of your own health.
See you next time.